Welcome to Read and Reaction. I'm Will Miles, and you can find me at readandreaction.com or on Twitter at WillMilesSEC. Today, we have a special guest, Alan Levine. So most importantly, Alan has a bachelor's and a master's degree in health science from the University of Florida, and he's recognized as a member of the University of Florida Hall of Fame. But he's also the executive chairman, president, and CEO of Ballad Health, overseeing the operations of a pretty big hospital system there. So Alan, welcome, and thanks for taking the time to join to talk to me about COVID-19, some of the implications of the football season, and then really try to get some accurate information out to people about the disease, vaccinations, the Delta variant, all that sort of stuff.
Oh, it's great to see you, Miles. I appreciate got your name wrong. I appreciate the work you guys do on. I always look forward to getting your detailed analysis after every game. In fact, I look forward to that almost as much as the game. So.
Well, I appreciate that. So, I guess to start off with, we got to go to the important stuff. So what's your favorite Gator football memory? You've obviously experienced the Spurrier era and the Urban Meyer era, and now we got Dan Mullen. So out of all of it, what do you think is sort of your favorite memory, and what do you sort of point to as a fan?
Well, I would say two of the ones that come to mind the most, or three. The Kentucky game, Werfel to Doring. I was there. It was magical. We were depressed. We were about to lose that game, and when he hit Chris Doring in stride in the end zone, it was unbelievable. And we didn't get to hear the Mick Hubert version of that till afterwards. And so it's when you watch it and you hear the Mick Hubert game calling on it, it's pretty cool. And the other one is just being in for the curl and go against Florida State, where we came back, and I think. Doug Johnson hit, I forget who he hit.
It was Jacquez Green, right?
Yeah, Kwesi Green. And just the way we came back and just took out FSU in that game, that was awesome. And of course, beating FSU for the national championship. Danny Werfel has become a close friend. Of course, we weren't friends back then, but it's fun to talk to him about those experiences. And, just seeing the success of the program. Jeremy Foley was a great athletic director. Scott Strickland, you could not have picked a better person to follow. Jeremy Scott's taking the program to the next level with certainly some great coaching hires, and his affability on social media, his connectivity to Gator fans. I'm excited about it. I happen to be on the board of governors for the state university system, so I'm on the board that governs Florida's 12 state universities. So they're all my children, right? But you're not supposed to have a favorite child, but University of Florida is close to my heart. So.
Well, they say you're not supposed to have a favorite child, but we all know that's not true anyway. So.
I'm not very good at hiding it either. So
no, it's funny. You mentioned the Mick call afterwards. I was at the 2006, the Tebow jump pass. So I saw that one live, and then got to hear the call afterwards. And in fact, Dave Waters was on the camera, like in the end zone, looking at that as that came to him. So it's funny to sort of see those different perspectives, and especially to go home. And that's one of the things we usually do. We go to a game, and then we'll come home and watch the replay after we get home if it's not too late, because it's become sort of a big family thing because my folks live in Gainesville there.
Well, I remember I was the Secretary of Health in Louisiana during the Tebow era. And it was fun, being behind enemy lines, living in Baton Rouge. And when Florida came and beat, in fact, I was the Secretary of Health in Louisiana during the last pandemic, during the H1N1 swine flu pandemic. And that was about October when Florida came calling to Baton Rouge. And it was just so much fun to just beat the crud out of LSU. It was almost it was so joyful to be a Gator fan there at that time, because those are some brutal fans, I will tell you. But I could do this all day. I mean, there's nothing like Gator, I tell you what.
We all can. That's why it's so much fun. So a little bit more serious topic. I've seen some writers recently. They suggested that COVID-19 may alter some of the plans for the football season in terms of attendance. And so, relevant to the people who are going to be listening to this, do you think there are going to be restrictions put in place at the Swamp due to that surge in Florida? And what do you think fans might see at the games this season? And even in that case, are there things that they can do specifically if they are planning to go to the game to make sure that they're safe?
I don't know. I don't know what the university is thinking about in terms of restrictions. I know the Board of Governors, we put out guidance to the universities that we strongly suggest they follow the CDC guidelines. And University of Florida has done that. I know with the student body and with the athletes, they're requiring masking indoors and things like that. Obviously, the swamp is an outdoor stadium. Whether they'll do anything beyond what the CDC guidelines are, I don't know. I think the best way to solve that problem is really for folks to get vaccinated. I mean, there's the single most important thing you can do to get back to normalcy is to get vaccinated. And I'm telling folks, even if you're outdoors, because of this Delta variant and how transmissible it is, if you're very close to a lot of people, it's really a good idea to be masked, particularly if you're not vaccinated, but even if you're vaccinated. So if you do have the infection, you at least don't spread it. But I will be at those football games. I plan to mask up and to be there to cheer on the Gators.
So there's been a significant separation of COVID deaths from cases, even if you look at Florida. So at the height of the last wave, which was in January, Florida peaked around 21,000 cases per day and around 215 deaths. For this wave, and realizing it's not over yet, Florida's going to peak, it looks like, around 25,000 cases per day, hopefully 85 or 90 deaths, which is where we are now, though I know there's sort of a 2-week lag there. So it does seem like the toll of the infection's been decreased by half. Do you think that difference is purely from vaccines? Or are there other things? You always, there's some of it due to vaccines, there's some of it due to masks, there's some of it due to the Delta variant. How do you sort of split that out in terms of what you think is most, because there's the most important, there's sort of the, there's levels and tiers in terms of what you might want to do?
Well, I think that the rate of death is generally not much different than it was before. I do think there's underreporting of cases a little bit now because people that are vaccinated, if they have mild symptoms, they may not go get tested. But I think the issue with Delta, like anything else, it's all about numbers. That, and even if the death rates or hospitalization rates don't change much, because there's so many more people being infected now, the overall numbers are likely to go up. The good news is, though, because of the vaccinations, those who are vaccinated who are positive generally do not have a serious illness.
So one of the things I was interested in, or at least surprised me when I looked at the Florida data specifically, is that the hospitalization rate for 25 to 34-year-olds in Florida, it's 83 for every case. For every there's 83 people get the disease and 1 person goes to the hospital, which isn't that far off from, say, 45 to 64-year-olds, where you're at 31 people get the disease and are hospitalized. Now, obviously, once you get up to 69 or 85, once you get up to those higher ages, that goes up considerably. But I guess sort of the thing that surprised me, and I told you this before we came on, is that before this, I would have said, if you're 25, 28, 29, you probably don't really, you should get the vaccine, but that the risks of COVID are relatively small. From a hospitalization perspective and just a capacity in the hospital, those ages are going to contribute significantly if you've got a strain that's moving through the community at a really rapid pace.
Yeah, I think one of the things that Governor DeSantis did that was really brilliant early on was when he focused on vaccinating the seniors and made that the priority, because that really was a very high risk population. So what that leaves disproportionately now is everywhere we're seeing younger people primarily that are being hospitalized. The average ages have declined. In fact, I've got 2 16-year-olds on ventilators right now in our pediatric intensive care unit. But a lot of our patients are younger, in their 30s and 40s, and so it is affecting people. And what I'm concerned about now is, when you have school starting and you have kids under 12 who are not vaccinated, and you have kids that are 12 to 17, the majority of which are not vaccinated. And even if you are vaccinated, you can still have the virus and spread it. I'm very concerned that what's going to happen is, we're going to see more of those kids end up in the ER or being hospitalized, but they're also going to go home and share it with their parents. If the parents are not vaccinated, you're going to see even more people in their 30s and 40s be infected, which of course then carries through. If you keep a common rate for hospitalization, you're going to see more hospitalizations. So I worry that with school starting, we're going to see another surge on top of what we've already seen. And again, it gets back to, if you're vaccinated, you're much less likely to have a serious illness. And the only thing is though, is I would encourage people to go now to get vaccinated, because it's, you have the first shot, and if you're doing Pfizer or Moderna, you have the first shot, then it's a few weeks before you get the second shot, and then there's 2 weeks after the second shot before you have full immunity. And so the sooner you go, the better. I'm not sure what at this point folks are waiting for. The data is pretty compelling that the vaccine is effective, and there are some potential side effects, and there are some potential serious side effects that are very rare. So it's not without some risk, but the risk of catching this virus and ending up either in the hospital or with long haul symptoms is much worse than the risk of the side effects of the vaccine.
Can you get into some of those side effects? Because I think one of the things that maybe concerns some people is that they hear get the vaccine, get the vaccine, get the vaccine. Oh, those side effects are minimal. I still think, at least, again, for me, I've got small kids. If someone says, hey, you need to vaccinate your kids, I want to understand what those side effects are, not necessarily because I'm going to say no to the vaccine, but because understanding those side effects helps me understand the choice that I'm making in a way that's more clear.
And what to look for. So, the side effects generally and by the way, all vaccines have potential side effects. The measles, mumps, rubella vaccine, polio vaccine, hepatitis vaccines, diphtheria, all vaccines have some potential for side effects. The most common side effects for the COVID vaccine and the flu vaccine are the side effects that generally happen when your immune system starts trying to fight something. So you might get headaches, you might get a little fever, you might get fatigue, body aches, or your arm might hurt where you got the shot. Those are the most common side effects. And again, those happen when those happen, that's actually an indication that your immune system is reacting and building an immunity. So those are actually a positive thing in terms of demonstrating that your immune system is working. The more serious potential side effects, with the Johnson & Johnson, there were some potential for blood clotting for women. The FDA determined that the risk of that was so low that they continue to keep it on the market. Very low, very rare. With Pfizer and Moderna, those are a different type of vaccine called messenger RNA vaccines. And I can explain how they work if you like, but the bottom line is for adolescent boys and young men, there have been some reported cases of myocarditis or pericarditis. Again, it's an inflammation of this tissue around the heart. It's treatable. You just have to know what to look for. And then I think, some Guillain-Barré syndrome, which is, or Guillain-Barré syndrome, which is when your immune system attacks the nervous system. And again, it could be very painful. Again, it's extremely rare. Guillain-Barré is a side effect potentially of the flu vaccine. So it's not an uncommon potential side effect. No worse than with the flu vaccine. But it's important that if people have a fear of that, it's important to respect that those are legitimate fears. And it's important to make sure people understand how rare those side effects occur. But here's the thing. Those side effects are also possible if you get the virus. The impact of getting the virus, even if you're not hospitalized. I know people that have gotten the virus who were not hospitalized, had a relatively minor case, but they still ended up with brain fog, some type of nervous system malady, cardiovascular issues, fatigue, long-term fatigue. Those are called long haul symptoms. The point is, this virus affects people differently, and it all seems to be based on some immune system or inflammatory response to the vaccines or to the virus itself. I really believe, based on the data and the research that's been done, that's peer reviewed, the risk of getting the virus is far worse than the risk of the vaccine.
Yeah, so a lot of times you'll hear people say, and I mean, I think this is a legitimate concern as well, right? That the vaccine has emergency use authorization for the FDA. And so the idea then is that if it was really, truly safe and fully vetted out, that it would have full FDA certification. Now, understanding that it takes time to do these sorts of things. I guess, can you sort of walk through, at least at a basic level, what it looks like to get something like this through FDA and
Oh,
why it's sitting in the intermediate stage or in that emergency use authorization, and what that really means compared to a full authorization from the FDA?
okay, that's a great question. And the technology behind these vaccines is not new. It's been in development for a couple of decades. The use of messenger RNA, and I'll explain sort of how that works. But first, let me answer your question. The fact that it's an emergency use authorization does not mean that any corners were cut. All of the processes the FDA uses to ensure efficacy and safety were done. What they did is they basically eliminated some of the whereas first one thing had to happen, then another thing had to happen. They allowed them to overlap certain studies, and also getting to do the trials, getting people to participate in the trials went very quickly because of social media, because of the fears of the virus. They were able to very quickly ramp up their trials. And so the development of the technology for the vaccine was not new. It was really just getting the trials done and going through the efficacy and safety phase. And they did every step you would do to get final approval was done. It was accelerated, but I anticipate that full approval is going to come very shortly. Basically, the difference between the emergency use authorization and final approval in this case is giving it time to collect enough data for some longevity, so that you understand, how long do you have the immunity? Do you need to do a booster? Those types of things. Typically, you go through a full process before you do the final approval, so you have that data. And I think that's to some degree what they've been waiting for. I anticipate within weeks we'll probably see a final approval. But if you don't mind, Will, let me tell you, the way the messenger RNA works, there's a few myths I want to bust here. First, the way these vaccines are working, you've got the messenger RNA vaccines, which is Pfizer and Moderna, and you have a viral vector vaccine, which is Johnson and Johnson. The way the messenger RNA works, what they've done is if you've seen the coronavirus, you've got the spikes, the spike protein. That spike protein is what binds to your cells and it replicates within your cells. And what they've done is they figured out how to replicate the code on the spike protein itself, not the virus, just that spike protein. They inject into you, right into your arm, the code that teaches your cells right there to make the spike protein. Your body, your immune system doesn't recognize that spike protein, so it attacks it. And it develops the B cells and the T cells to recognize that spike protein. So when a virus hits you, when you get hit by the real coronavirus, it identifies those spike proteins and it attacks. And so the vaccine is not, you're not like with the flu vaccine, sometimes you're getting really a live virus or even a dead virus, either a dead or a live virus, depending on the vaccine. The virus is not being injected into you. It's just the code that teaches you how to generate that spike protein. Now, the difference between, there's been questions about, well, you see the number of breakthrough cases, that people who've been vaccinated and they're getting COVID. The reason that's happening is, I use the example of you have a fire extinguisher in your kitchen, right? So if you're like me, you're not a very good cook and you don't know how to use grease on your stove, and you might end up with a grease fire. You run and get your fire extinguisher and you put out the grease fire. So the fire extinguisher is your immune system and it puts out the fire, but some damage got done in your kitchen, right? So what's happening with the Delta variant, which is different than the Alpha variant, the Delta variant replicates very quickly, much more quickly than the Alpha variant. So you might be vaccinated, you inhale the Delta variant because someone spoke to you and it got into your sinus or into your nose. Immediately, it starts replicating before your immune system has a chance to start fighting it. So what happens is it's replicating very fast and it starts to bind to your cells, but your immune system reacts. So your immune system defeats the virus. Your immune system defeats it, but like the fire extinguisher in the kitchen, a little bit of damage got done. So you end up, you have the virus, you might have some symptoms, but it's because your immune system beat the virus. And that's what's different. A lot of people got confused, like, wait a minute, I got vaccinated. Why am I getting sick from the Delta variant? It's still working. It's just that it replicates so fast, it does so before your immune system has a chance to engage. But once your immune system engages, you beat the virus.
And so there have been some recommendations from people in terms of, even if you've had COVID, that you should still get the vaccine. But there's also, I think, some confusion because, again, your immune system's already defeated it. You've already built up those cells that should be able to help you out. And you'll hear people talk about, well, I trust my immune system and those sorts of things. So when it comes to natural immunity, can you sort of describe what's out there and what the recommendations are, and then also why those recommendations are the way they are for that?
Great question. The science is still emerging on natural immunity versus the vaccination, but based on the body of data I've seen and what I've read, and what's evident is that natural immunity does work. It is real. However, what the studies seem to be showing is that if you had COVID and a very mild case of COVID, you're not developing as much immunity as somebody who had a severe case. The more severe case you have, the more robust your immune response is going to be, and the longer you're going to have that natural immunity. There's still some question. The studies range anywhere from 10 months to 12 to 16 months. Your immunity lasts before it begins to wane. So some virologists are suggesting, and I can't say that there's yet a lot of evidence here, but it seems logical. What they're saying is, if you've had a case and you have natural immunity, if you get one shot, either Pfizer or Moderna, not two of them, but if you just get one, it will give you it'll give you a robust immune response, more so than if you just rely on your natural immunity. It's legitimate. If you've had a case of it, you're going to have some natural immunity. The question is, how long does it last? And if you had a mild case, it's very likely it doesn't last as long, and your immune system response may not be as robust as if you had a more serious case.
So it also feels like a lot of the, at least communication that comes out, is about masks, right? That masks are, and I'm not someone who disagrees that masks work, but it seems like it's worth emphasizing that vaccines are a far more effective preventative measure to masks. So that, first off, that's correct, right? And then the other thing is that from a public health perspective, when you ask vaccinated people to wear a mask, my concern is that that's a disincentive for people to get vaccinated, that the return to normal is the carrot that you're holding out there for people to get vaccinated so that they don't have to wear the mask.
There's been, going back to the early days of COVID, if you remember when it first started, the CDC said, don't need to wear masks. Then they came out and said, we need to wear masks. And people got really confused by that. There was a reason that happened. Number one, early on, they weren't sure of how transmissible COVID was. And number two, one of the big concerns was you want to make sure you protect the healthcare workers first so that they're available to care for people that are sick. And there were concerns, legitimate concerns, about the supply chain and whether or not there were enough masks. So the CDC was balancing all that. I don't think they did a great job explaining all that. So that created confusion, and that confusion is carried forward because when the recommendations change during a pandemic, it's not that science is lying to you or misleading you. It's that science is learning. So it means that we've learned something new, and it's important for everybody to know what we've learned. Here's where we are now in terms of, first of all, you could not be more correct. The single most important thing you can do is get vaccinated. But in public health, we like to use the example of the Swiss cheese model. If you line up a bunch of slices of Swiss cheese, the holes don't all line up exactly. A virus will move through until it hits one of the layers. At some point, it's not going to hit a hole, it's going to hit a piece of cheese. And that's kind of the approach with public health during a pandemic. It's a multi-layered approach. Get the vaccine. If you're in proximity to people where there's a potential for spread, wear a mask. Hand washing, hygiene, all of those things combined substantially reduce the likelihood of spread. As it relates to masks, here's the issue that I think is more important. Masking works, and you know, when you go into an operating room in a hospital, everybody in the operating room is wearing a mask. Why are they wearing a mask? They're wearing a mask to protect you, the patient, because one of them may have a cold, one of them may have a virus. They don't want the patient who's on the table to catch that virus. And so masking is, it's more about keeping you from spreading it to someone else. If you're in a room, if you and I are in a room and I have COVID, but I'm not wearing a mask and you are, you're less likely to catch COVID from me because you do have a barrier. But if I'm wearing a mask, your chance of getting COVID, particularly because you're also wearing a mask, is reduced to very low. And so this whole issue of masking in schools, I think the concern about children having to wear masks and some of the consequences for children about whether it be mental health or acne or, you know, carbon dioxide, all those things are legitimate concerns. But to me, those are very secondary. You want to first protect against the worst possible outcome, which is that they catch COVID and spread it to other people. And so I'm a believer that mandatory masking in schools, at least for a period of time until we get to the peak and it starts to come back down, I think it's important to protect, you know, if I'm sending my kid to school, it's not as important for my kid if he's wearing a mask, because I know my kid is protecting other kids by wearing a mask. But what I want as a parent is to make sure those other kids are also wearing a mask to protect my kid. And so when I hear people say it's all about personal choice, I don't think we want individual parents deciding whether or not their kid should have polio vaccine. Or, you know, as a society, we've decided there's certain things where no, the parents don't get to not buckle their kid up with a seatbelt. It's the law that kids have to wear seatbelts. It's the law that our kids have to be vaccinated to go to a public school in Florida because we don't want to have measles outbreaks. And so I understand as a parent the importance of having that choice, but I also understand that if I'm complying with it, I want other people to comply with it to protect my child. And so that's the issue. And it's heated. I know it's very, it's a hot issue right now, but I don't want anybody to have regrets. And you know what we've seen, Will, in the hospital, the number of times I have seen cases where we're about to put somebody on a ventilator and they ask if they can get the vaccine. And at that point, it's too late. And the regret, to see the regret, I don't want these parents to regret that their kids weren't protected. And so I realize it's unpopular, but that's, you know, my job is to protect these kids and unapologetic about that.
No, I understand. I mean, I think, to be honest, I think some of that comes from the slippery slope argument, right? Like, I saw the impact that virtual school had on my kids firsthand. And the question then is, where does your personal freedom end and where does your, where does, and that's the thing, right? Is that everybody has a different way of analyzing that. And that then you usually have either a governor or a small set of people who are establishing what that is for an entire state. You're obviously going to have people who agree or disagree on either side at that point. But, you know, that would be my concern, is that it's if the government can come in and say you have to wear a mask, then the government can say you have to do virtual and can say those sorts of things too. And I've seen the kinds of effects in particular so I have a friend who teaches in a low income school, and the number of people who were reading at grade level last year were considerably less than the ones who normally are, right? And so there are consequences beyond just contracting the virus that people are trying to weigh here. So I don't want to, the concern I have is that people who have those concerns oftentimes are dismissed as stupid or dismissed as ignorant because they have a different set of values. I think it's important to at least make sure that we're acknowledging that this is a question of that everyone has a different line, and that you have a line and I have a line and other people have a line. We need to we need to have good faith discussions about where that line is. But when you dismiss someone as being stupid or ignorant, you immediately have prevented them from engaging in the discussion, which I think is a big reason why people get entrenched in sort of their opinions, whether it's vaccinations or masks or anything else.
I think you're 100% right. If you've seen the things I've written, I've been very careful. I've learned long ago, when I have a disagreement with somebody, the last thing I do is question their motive. I believe people have good motive generally. I mean, I don't, to your point, across the country, because of virtual learning, we have seen a backslide in third grade reading, math, across the board. We've gone backwards, and which has been horrible for these kids. The most important thing to do is get them back in the classroom where they can engage in learning. And my concern, honestly, Will, is the single biggest way to go back out of the classroom is to have massive outbreaks at the schools. And look at what happened in Mississippi. They started schools, no masking requirements. Within a week, one of the largest school systems in Mississippi had to shut down and send all the kids home because they had such a massive outbreak. And by the way, now in Mississippi, they're setting up hospitals in garages because they're getting overrun with cases. It's one of those things where you'll never hear me dismiss somebody's argument. In fact, it helps me with my argument if I understand what their concerns are, so I can address their concerns. I readily acknowledge some people are concerned about the side effects of a vaccine. I'm the first one to say, you're right, there are side effects. The issue isn't whether there's side effects, it's you have to decide, you yourself as an individual have to decide which is worse, the side effects of the vaccine potentially, or the potential side effects or effects of the virus. And then you can make a reasoned, informed decision. And that's, I agree with you 100%. To me, the most important thing is to get these kids back to a sense of normalcy. And there's no daylight between us on that, I can assure you.
So last question from a COVID perspective, then I got one more football question for you. But so the Delta variant does seem to provide a new wrinkle here in that seems to be much more transmissible. And so I guess I'd be interested in understanding the burden a hospital feels when it's starting to fill up with COVID patients, because obviously things like just bed availability, being able to do elective procedures, those sorts of things get impacted. So, I think everyone was I think a vast majority of people were on board with the 2 weeks to slow the spread at the start, which was an awesome message to start with, but has become a rallying cry for people from the standpoint of feeling like they've been misled. And so I think we're getting to a point now where hospitals are starting to get overrun, and generating some of that social responsibility may actually be something that is useful. So can you sort of speak to the burden that your hospitals are feeling, or we were talking before we came on about the pediatric hospitals, and sort of, the types of things that are going on at the hospitals right now where sacrifices are being made because of the surge?
Yeah, I mean, in fact, my health system. I have 21 hospitals that I'm responsible for, and we just announced today that we're deferring elective non-emergent surgery starting on Monday for that reason, because we have to preserve space and staffing to care for the burgeoning number of COVID cases we have, plus all the other stuff, the heart attacks, the strokes, the car accidents, and all the other stuff. There's two issues here. One is pediatrics, children, and the other is adults. With children, it's important to understand that the infrastructure for healthcare for children was not designed for the volumes that we're seeing. Children generally don't get so sick they have to go into a hospital. And if children have to go to a hospital, they're really sick. And so if you look in Tennessee, for instance, there's only 5 children's hospitals. I use Tennessee because that's where I live. There's 5 children's hospitals in Tennessee. And so my children's hospital, Nicewanger Children's Hospital, incidentally, which Tim Tebow put one of his Tebow playrooms in our children's hospital here in Johnson City, right in the shadow of University of Tennessee. But my children's hospital only has 10 pediatric intensive care beds. I've got 3 children now occupying those beds with COVID right now. It will not take much for us to get overwhelmed. And that's what you're seeing in Louisiana, in Arkansas, and in Florida. You're seeing the children's hospitals begin to fill up. And that's a serious concern. And because there's, for instance, in my case, whenever my children's hospital gets full, I always lean on Vanderbilt University or East Tennessee Children's Hospital over in Knoxville. Those hospitals are filling up. And so we're on our own. So once I hit 10 pediatric intensive care patients, what am I going to do at that point? So that's what's got us concerned, and why I want to do everything we can to prevent these kids from being exposed. Now, my other concern is when you, like in my case, we have 169 inpatients right now with COVID. There's a national nursing shortage. There was a nursing shortage before COVID. In fact, between 2019 and 2030, it was projected that 1 million nurses were going to retire from the system. The average age of a nurse now is 50. So that tells you we're heading into a period where there's going to be massive retirements. And COVID has accelerated that. Nurses are exhausted right now. And so as the Alpha variant started to decline, when everything started to feel normal back in May and June, and all the volumes went down, we started to see nurses submit their resignations. They're like, we're done, we're exhausted, we're going to go do something else. And then all of a sudden we got hit in July with this resurgence of the Delta variant. And so now we're all heading into this, and with the Delta variant, we're all short staffed. And so right now I'm at 90% capacity based on the staff availability that I have. And so I'm so thankful and grateful for the nurses that come to work every day. They could just as easily, and I will tell you, there is a high level of frustration from the medical profession and the nurses when they see these patients that are not vaccinated come in and occupy these beds, and they see the ER wait times at 8 to 10 to 12 hours because they can't get to those patients. It is frustrating for these nurses because they feel like these admissions are preventable. And that's the message, honestly, I would say to folks is, there are people who have legitimate healthcare conditions, cancer, strokes, cardiovascular conditions that need access to these hospitals, and it's being supplanted by the COVID volumes because there's just not enough staff to take care of everybody. And my fear, and the fear of any hospital leader, is if you get to a point where you can't take care of everybody, then you have to start prioritizing who gets care. And that is not a position anybody wants to be in, but it's happening. You can see it. And what I'm concerned about from my perspective is, as I watch Louisiana and Tech, you saw the governor of Texas is asking for staff to come into his state from out of state. Louisiana has got military support now to add capacity of the hospitals. What I'm concerned about is we're now starting to see the increase in East Tennessee. And what's going to happen if I run out of staff and I need help, but they're already over in those other states? And if help's not there, what then? And so that's what has hospitals concerned. And again, the easiest way to help nurses and doctors manage through this is for people to get vaccinated.
And well, it seems like there were 3 options originally. One was get it, one was don't get it, and then the third option was the vaccine. But with the Delta and the way it's sort of spreading, I don't know if there's that don't get it option anymore, right? That it's either going to be you're going to get it or you're going to get the vaccine, and you got to hope that you're able to fight it off if you don't have the vaccine before it gets you.
Yeah, that's true. I mean, I've seen, and early on, it's true that if you have comorbidities, the elderly, diabetes, asthma, obesity, cardiovascular disease, if you have multiple comorbidities, you are definitely at higher risk. You should absolutely be vaccinated. But we've seen people that are otherwise healthy. We've seen people that are marathon runners who show up and have to be hospitalized. It's hard to explain why certain people react a certain way. This virus is very different than anything we've seen. With polio, Ebola, it's interesting. If you ask an epidemiologist, Will, which kind of virus would they prefer to see? A highly deadly virus that's not very transmissible, or a less deadly virus that's highly transmissible? Any epidemiologist would tell you they'd rather have a highly deadly virus that they can contain as opposed to one that's less deadly, but you can't contain. And so right now, this is what's got epidemiologists and virologists so concerned, is they've got this highly transmissible virus, Delta variant, and behind it, you got Lambda variant coming potentially, which may be less responsive to the vaccine. And so, viruses, like anything, like any living entity, they seek to survive. And the thing about viruses, the way they survive is they replicate. And the way the DNA of a virus works, the RNA, it peels off and it starts to create new virus. As it replicates, there's opportunity for imperfections in that process. And that's how a variation occurs. You've got the code, it rips off the code, starts a new cell. Well, sometimes that code doesn't get transmitted properly, and that becomes a variant. The longer this virus circulates in the community, the more opportunity there is for another variant. And that's what I'm concerned about, is as long as these vaccines are effective, we're in good shape. But if we keep getting these new variants, at some point, the vaccines become less effective and we're right back where we started. And so the faster you snuff it out, the better it is in terms of making it, I think, less deadly and less transmissible.
So get vaccinated, everybody. That's the message from Alan here. Get vaccinated. If you got to wear a mask, wear a mask. If you got to socially distance, but get vaccinated. That's the best way that we can get back to some semblance of normal here. And speaking of normal, then we got Alabama coming to the Swamp this year. So got to get your prediction before you get off. What's your prediction with Nick Saban coming in with a brand new quarterback?
Well, I'm excited about Emory Jones. I think he gives, and you've said this, I mean, he gives us so many more tools. He can throw and he can run. The question is, has he perfected his judgment in terms of when to do which and when to scramble? I think Alabama is going to struggle against an Emory Jones led offense. I'd predict, being in the Swamp, I can't even imagine how loud it's going to be. But it's Nick Saban and it's Alabama. So I think Florida's going to pull it off. I have enormous confidence in Dan Mullen. It's fun to watch him. He's having fun. His players are having fun. And you know who I'm watching, who I think this kid is going to be amazing for a lot of reasons. Donovan McMillan, the guy in the backfield. This kid's got a personality. He reminds me of Tebow. He's got high energy. He's motivated. The kid's hysterical. I mean, he's fun to watch. But if you look at him from a talent standpoint, he's fast. He's in great shape. I think he's going to be a great addition to the defense over time. I mean, I really do think. I think both sides. Well, I don't even know how I can do analysis. I can't run, buddy. You can run circles around me on analysis, but I really am excited about what Dan Mullen's building, and it's fun to watch. You asked me for a prediction. I think Florida wins by 2 touchdowns.
Oh, wow. 2 touchdowns. Well, from your mouth to God's ears on that one. We'll certainly hope so. But Alan, thanks so much. I appreciate taking the time, and everybody out there. I know this is a little bit different, but wanted to get this information out to people and make sure that, anybody who hasn't heard it yet hears it from somebody who's an expert. And I'm definitely not an expert. I've written about it a little bit, but wanted to make sure I got somebody in here who knew what they were actually talking about. So Alan, thanks so much for your time. Really appreciate it.
Hey, go Gators.
If you like these videos, please consider supporting me on Patreon, or you can follow me at WillMilesSEC on Twitter or at Facebook.com/ReadAndReaction. Until next time, be a smarter fan.